Resume recording. Awesome. Okay. So to everyone online, thank you for joining us. This is our second of our webinar series. And today we have Dr. Michelle Murphy presenting. Michelle works at the Princess Alexandra Hospital as the Director of Respiratory and Sleep Medicine, has been through quite a lot of career iterations on her way to becoming the Director of Respiratory and Sleep Medicine at the PA, but has also had interest and involvement in medical education, particularly at the level of specialists in training, and has been involved with the Advanced Training Panel and the Royal Australian College of Physicians for many years. Outside of medicine, she does find time to enjoy things like hiking and going to the beach and traveling, although that's been somewhat curtailed during the last year and a half, and she's sticking to Mount Coot-tha. She is also the mum of two teenage daughters. So her plan today is to tell you a little bit about what she does and also what the sort of things that she feels is important when you're considering your career in medicine. So thank you, Michelle.
Thanks, Rachel. So for some of you who probably overheard that conversation, Rachel and I know each other outside of work as well as in work. So what I'm going to talk to you about today is respiratory and sleep medicine. But first of all, I would like to talk to you about this. So for a lot of my junior staff, I talk to them and give them a bit of career guidance, and this is the guidance I give them. And the reason I'm doing this first is then I can use that to explain what I do and why I chose to do what I do. So I think that the reality of training in medicine is there are going to be choices along the way, and there are going to be some sacrifices to be made. And that's just how it is. But you do have some control over that, and the sacrifices you need to make will depend on the choices that you make. So I think it's important that you are very honest with yourself. You need to be very realistic, and you need to think about your future and your priorities. And a lot of people who end up in medicine are very driven and are very goal focused and also want to please people. And I think sometimes that can lead to them making decisions that might not have really been what they really wanted to do in their heart of hearts. So I think the earlier on you just decide that you're going to do what's good for you, the happier you are likely to be in the longer term. You need to think about what the work is. And so what is the bread and butter of the specialty, right? So in every specialty, there's the exciting whiz-bang stuff or the really things that you might love at med school because it's so academically interesting, but that might not be what you're just going to see day in, day out. So if you become a cardiologist, you might love, people having STEMIs and fixing them and pulling them back from the brink. But the reality is you're going to see a lot of atypical chest pain. The reality of respiratory medicine is I see a lot of people who've got breathlessness. I love the procedural and the complicated stuff, but the reality is it's breathlessness, right? And every specialty is like that. And you need to like that. If you want to be an endocrinologist, it's going to be diabetes. Doesn't mean you're not going to see other stuff, but you need to be comfortable with the bread and butter. You need to think about whether you want to work in an inpatient setting or an outpatient setting, because the specialties vary a lot with that option. And you need to think about what are you good at? Play to your strengths and what do you like to do? Because if you're going to be doing this for the next 40 years, you need to like it. You need to think about the training pathway to get there. How long is it? What's going to be involved? Are you going to have to work ridiculous hours? When I trained in respiratory, I did every night on call for 2 years, every weeknight and every third weekend. I just never saw my partner. That's just the reality of when I trained, and that was a long time ago. It's a bit different now. But some training programs, they're very arduous. They're going to send you out of Brisbane. You're going to go and work a long way away. You might be away from your partner or your family or your friends. And you need to have a think about that. And you need to think about whether that's something you want to do. And if you really have your heart set on it, then it's worth making those sacrifices. But I think you need to be honest with yourself about that. You need to think about what's life when you actually get there. Okay. Now, when I was a registrar, I was really happy to do that on call. I loved it. It was so exciting. But I don't want to do that now. Once I, had a couple of children, my priorities completely changed. So I'm not saying that you have to have children, but when you're a consultant, you do have some control, but your specialty also dictates that as well. And you need to be really honest with yourself about that. If you don't want to do a lot of on-call and weekends, there are certain specialties that you shouldn't do. Or you might not want to work in public where you're going to have to do a lot of that. Or you might not want to work in private where you might have to do a lot of that. So you need to think about it. You need to think about where you want to work. Do you want to work in the city? Do you want to work regionally? Or do you want to work rurally? And each of those has pros and cons. If you want to go and set up practice in a regional centre, what if you're the only specialist there? Does that mean you're on call all the time? And what's that going to look like? And it's going to be quite difficult for you. The medicine might be great, but it might have a big impact on your personal life. And that's where I think honesty and reality is important early on. What about money? Let's face it, the specialties vary a lot in how much money you make. And for some people, that is a strong motivator, and for other people, it is not. You need to think about travel opportunities. Medicine's a great career for travel, but it depends a lot on your specialty. And is it cross different states, or does it cross different countries, and how is that going to work for you? And you need to think about your other priorities in life. I've got colleagues who just love their job. They're happy to be here every weekend. Like their partners are driven crazy because they're never taking any kids to sport on a Saturday morning, but they love operating. They'd rather be in here doing something, and that's great for them. And that might be great for you. But if that's not great for you, then there are specialties that you probably should not do. Okay, so that's my general blurb. And now I'll tell you why I ended up a respiratory physician and not a surgeon or an oncologist. So this is what I do. So respiratory medicine, as you all know, are diseases of the airways, the lung parenchyma, the pulmonary vasculature, the pleura, the chest wall, and respiratory muscles. And the various disorders can be everything from infections through to cancers, through to congenital abnormalities, through to genetic diseases like cystic fibrosis, the neuromuscular diseases like motor neurone disease. So it's a very, very broad specialty. And within that, there are various subspecialties that you can go into. So for instance, you might subspecialize in airways disease, you might subspecialize in interstitial lung disease, or you could work somewhere like I do, where we have a very broad specialty base, and then we have areas of interest. So I do a lot of procedural work because I really love procedures, but I decided I didn't want to be a surgeon because I thought surgery was becoming very super specialised, and I didn't want to do the same procedure every day, all day, because I'd get bored. So I get to do my various different procedures, everything from bronchoscopy and convex EBUS to medical thoracoscopy, where we look inside the pleural cavity and chest drains and stuff like that, and I love it. But I don't want to do that all day, every day. I really, really like malignancy, but I had an epiphany when I worked in the UK and realised that if I became an oncologist, I was going to burn out, because I have trouble keeping, an emotional distance if I do that all the time. So I do a lot of cancer work, but that's particular to the hospital that I work in the department I work in. Other respiratory physicians diagnose lung cancer but don't manage it, where we do the diagnosis all the way through the treatment, the management, and the death here at the PA. But that's unique to where I work. And that's something that you need to think about when you do your specialty training, because it might be very different where you go to work. So respiratory medicine in private is very different to what I do. A lot of the procedural stuff I do in public, in private sector, would be done by the thoracic surgeons. We have a high dependency unit here at the PA, so we do a lot of ventilatory failure, and I love acute medicine. I love people that are really sick. I love getting them better, and I find there's a real thrill in that kind of diagnosis and management aspects, and seeing them better and leaving the hospital. But I also really like getting to know people over time. I'd be terrible in ED. I like my patients. I like the fact that they know me. A lot of them know me from when I had my children, and they're like, oh, how's X and how old is she now? And I really like that as well. So respiratory medicine gives me a bit of both. It gives me the thrill, and it gives me the kind of longevity with knowing my patients over time, which I enjoy. I've mentioned the procedural work. The other thing we do is a lot of respiratory physiology, lung function testing, reporting, cardiopulmonary exercise testing and assessment for surgical risk, and supplemental oxygen and non-invasive ventilation. And I find that quite academically interesting, but I also just find it kind of fun. Okay, so it's especially where you can see people in clinic, see people on the wards, and you can also do reporting. The other thing I like about working at the PA is it's a big teaching hospital, and that's the thing. One of the reasons I chose to work publicly is I was really interested in with medical education. So I do a lot of teaching here, and I really, really enjoy that. And that was a big draw card to come back and work at the PA. Part of it was the medicine in my department that I work in, and part of it was the education that we offer. Now, what about sleep medicine? So lots of people say to me, well, how on earth, why did you do that? Like, how does that fit with respiratory? So if you can't breathe when you're awake, you certainly can't breathe when you're asleep. So there is a big overlap between respiratory medicine and sleep medicine, but they are quite different. So sleep medicine is everything from the sleep breathing disorders, and you would have all heard about sleep apnea and hyperventilation and things like that, through to the insomnias, through to things like narcolepsy and idiopathic hypersomnia, the circadian rhythm disorders, you know, people who go to bed really late and wake up really late, or go to bed really early or wake up really early, but shift work and jet lag disorder are in that category. The parasomnia is the weird stuff, you know, sleepwalking, sleep talking, sleep eating, sleep sex, all of that kind of stuff, and the sleep movement disorders. So it's a very broad specialty sleep medicine. And what you see in sleep will depend on whether you work publicly or privately. And publicly, we do a lot of sleep disordered breathing and out. But if you were a private sleep physician, you're probably seeing more of the unusual parasomnias and that kind of stuff. We do a lot of work with respiratory failure and ventilation, tracheostomy ventilation or non-invasive ventilation. And I find that really rewarding because you can make a big difference to people's quality of life with that. Sleep medicine is mostly an outpatient or consult service. We don't, here at the PA, we have an inpatient service, but mostly it's an outpatient job. So it's great if you want lifestyle. You know, if you want to have a private practice, very controlled, there's very few sleep emergencies. So you're not going to be called at all hours of the night about stuff. We have a high dependency unit here, and that's a bit unique to where I work, and we do a lot of non-invasive ventilation through there and tracheostomy ventilation, but that is not common. You get to do sleep reporting, so that's nice from a lifestyle point of view. If you want to work particularly in the private sector, reporting, you can do that from home, so you've got a lot of control over your hours. And we do various therapies. So everyone knows about CPAP machines and BiPAP, but the other things are things like mandibular advancement splints for people who have mild sleep apnea or snoring, various medications, not so much for insomnia, but more medications for narcolepsy with stimulant therapies, and a bit of psychology that's largely in the realms of insomnia. And I've already talked about respiratory failure. So complementary specialties, but quite different in what you see and how your lifestyle might pan out. For other training pathways, so for respiratory medicine, you do your intern and junior house officer years, and then you do basic physician training. These days in Queensland, that's all part of network. So you will join a network and you'll be rotated between hospitals in that network. You sit your written and clinical exam. You have to be at least 4 years out of med school. Often people are in their 5th. And then once you've passed your exam, you then enter advanced training in respiratory medicine. That's 2 core years of training, and then you need to do what used to be called an elective year, and it's now called a complementary year. And in that year, you might do anything that relates to respiratory. So a lot of people do sleep, but you don't have to. You might do a year of cystic fibrosis or interstitial lung disease or respiratory procedures, but you're also able to go and do a year of infectious diseases or immunology or anything really that crosses over with respiratory. And many people then do a subspecialty fellowship. So for me, I did my core training here at the PA, then I went to Perth. I did a year where I did a lot of research on lung cancer and mesothelioma, and then I did a year of sleep and physiology over there. But the subspecialty training, often people go interstate or go overseas, and that was before COVID. That's become a little bit more difficult now. The training sites in respiratory are listed there. So we have training sites throughout the state, and it's all centralised in regard to appointment, and that will depend on a written application, a CV and an interview, and then we rotate our trainees annually between those different sites. And you can kind of pick and choose how that might look for you. So trainees might choose to have a year in Cairns and a year at the PA. You're not on a fixed pathway. Sleep medicine is the same, and because most people dual train with respiratory, they do 2 years of core respiratory and then they do their sleep training, but you don't have to. You can train in sleep medicine independently of respiratory. So for instance, you might do neurology and you might be really interested in things like narcolepsy, and you can train through that way. It's a little different. If you train with respiratory, it's an extra year for the sleep medicine. If you train through other pathways, it's an extra 2 years. Once again, we have a centralised appointment process for that, and with a panel and the usual application as I've written there. My advice for respiratory, if you're interested, it's a really useful specialty to do in your junior years because it crosses so many other specialties. It's worthwhile doing a rotation to see if you like it, because sometimes what you like in theory is not what you really like in reality. And so doing one rotation, but you don't need to do more than that. Like I have people apply for respiratory jobs and they've done 3 rotations, and I just think that's a waste of their foundation in respiratory, in medicine in general. So I think a single rotation is enough. You'll know it after that, whether you like it or not. It's important to get to know the people in the specialty. We have various educational opportunities. We have dinner meetings you can come along to. You can do research projects or audits or quality activities, and that demonstrates sort of commitment to the cause, but it's also a good way of getting to know the specialty and those that work in that, and you can attend meetings and conferences. Lastly, if we change, these are my tips for things along the way. These are not specific to respiratory, but I think they're really important take-home points. When you become a junior doctor, it's really important that you're nice to the nurses. Really important. It's important that you're respectful to senior medical staff. You know, it's surprising who knows who. So you might want to come and work with me, but you really don't want to do physician training. You want to be a surgeon, but medicine's a small world. Okay, so just be nice to people, get on with people, be helpful. It's really important you realise how important you are as part of a team. You know, my interns they're the glue that makes the department work. If they're not interested and they're not working well, then the whole system begins to fall apart. It's important you're organised. If you don't know, you should ask. And the other thing that's really important is don't end up doing what this is over here, where it says medicine and work and social life are parallel lines and they don't cross. That is terrible advice. You need to look after yourself. You really need to look after your colleagues. You really need to plan for life outside of work. If you just sort of think on your spare time you'll catch up with your friends, it ain't going to happen when you get into your training years. You need to make an effort to book things in. So for instance, I subscribe to the ballet. I like the ballet, but the main reason I subscribe is that I see my friends. So we subscribe because then it's in the diary and then we catch up with each other. So something like that I think is important. Don't be afraid to move around in your junior years. It's great experience. Don't be afraid to try different things and see what you might like. And most importantly of all, enjoy the journey because you're in for a really great career.
Thank you so much, Michelle. That was really good. I just have a couple of questions.
Yep.
Just sort of reading through the chat. So, well, the first of all is a bit selfish, but not on behalf of the UQ students. You mentioned some networking and sort of dinner meeting opportunities. Would it be possible for us to have those links if you email them, and then I can put them on the website so then all of our students can review them? Excellent.
So I think with your, when you're in the hospitals, if you're interested in a specialty, it is worth going to the ward where that specialty is and introducing yourself, okay? Particularly to the registrars. They are the most accessible, right? And say, you know, that you're really interested in X and are you able to come along, okay? And I think most specialties should be open to, you know, showing you what it's like. And if they're not, then you might want to think about whether that's really the specialty you want to be joining.
Probably good advice. The second thing is in terms of getting on to training. So my understanding with the basic physician training is it's an application process.
Yes.
Then for advanced training, it's a next step application interview process. How competitive is respiratory medicine?
So over the years, the number of respiratory positions in the state has rapidly increased. So there's 17 in the state. We are always oversubscribed. So the things that make a difference are that you've shown some enthusiasm towards respiratory medicine. So clearly, if I have 2 applicants that are the same on paper, the one that has come to meet me, that has done some research or audit work or a quality activity or, you know, done something to show that extra bit of interest will make a big difference in setting you apart. The other thing, though, about respiratory is I clearly love respiratory, but we have a very young workforce in Queensland. So because of that, and because there's now a lot of training positions, consultant jobs in the public sector are completely full. So if you're interested in working publicly in respiratory, you're not going to be working in Brisbane, in my opinion. because it's a very, very young market. Like I'm a dinosaur, everyone else is much younger. If you want to move outside of Brisbane, then there are lots of job opportunities in Queensland. And clearly, if you want to move interstate, there's lots of opportunities. But in Brisbane, the job market is saturated. So you might be able to get on, but it's the next step that's going to be more of an issue, I think, for respiratory.
And one more question, in terms of getting onto advanced training, is there a sort of a significant amount of research that needs to be done, or is
No.
it just one of the things for your
No,
series?
no. And you don't have to do research. So when we look at the applications, we like people that have done something extra, but it doesn't have to be research. So we've had people that have done, additional work in the fields of medical education, for instance, or teaching. So it's something that sets you apart from everyone else. And so for some people it's research, but for some people it isn't. And as I said, those other things can make a difference. You've been on committees, you've been part of the Junior Doctors Society and Wellbeing, and you've done something extra that just sets you apart from the pack. But it doesn't have to necessarily be research. But research is easy to get started. Research, audit, quality work, quality improvement initiatives and things like that. It doesn't necessarily have to be in respiratory medicine, although clearly it's better if it is, because it probably means that you've gone and met someone who can advocate for you. So that I think is worthwhile if you're interested. Yeah, and it gives you a bit of a feel for whether you really like that type of work or not.
Excellent. Well, thank you very much. If anyone else has any more questions for Michelle, you can always sort of put them in the chat and I can put them to her later, or something like that too. So thank you so much for your time,
welcome.
Michelle. It was great to have you. Our next speaker today is Melissa. I might just get Melissa to sort of, I'm not sure how to actually get you to change over, but I think hopefully you're listening and able to unmute yourself, and then share your screen and we can go with Melissa.
Hi there, Rochelle. Can you hear me?
Oh, brilliant. Yes, I can. Thank you.
Excellent. Now, I am not the best technologically, and now I can't.
Used to Teams.
Now I can't. Something weird has happened with my Zoom. There we go. Now
do
I'll
you
just.
want to? Sorry.
I was just going to say I'm trying. Yes, and I'm trying to share it, but it says I can't whilst Michelle is still sharing her screen.
So, Michelle, can you unshare? Hold on, I can do that. I can take her out. Haha.
Okay. Oh, there we go. And now I can see. Okay, great. So now I'll just click on the share screen.
Perfect.
Okay. Go. Great. So is that all working?
Yeah, that's brilliant.
Excellent.
And
okay.
Melissa, I might just give you your quick introduction.
Oh, sure.
So we're very grateful to have Melissa here today, who is a dermatologist coming from Brisbane, and is purely in private practice, I think, at the moment, and has done all of her training in Brisbane as well. Outside of medicine, Melissa has 3 children and has managed to do that before, during, and after registrar years. So that's quite a feat in of itself. She plays trumpet and piano, loves music, and participated in the Med Review, and started an award-winning community orchestra, which actually helped her get into dermatology, which sounds fantastic. So Melissa's going to talk about what dermatology is like, the pros of the specialty, and she loves it so much that there isn't any cons, and how you can get onto the program. So thank you so much, Melissa.
Okay. No problem. Okay, so hi everybody, and thanks very much, Rochelle, for this talk. I think it's an excellent series for the students. So I thought we would start by saying what actually is a dermatologist. So it's a specialist medical doctor who purely deals with conditions of the skin, hair, and nails. And the skin is not just your actual skin, but also oral, genitals, basically anything external from head to toe. We deal with patients from the newborns to the elderly. So it's not just, like obstetrics where it's a particular patient cohort, it's everyone that we can see. And so common conditions that I would see in private practice on a daily basis would be things like psoriasis and eczema, so inflammatory kind of chronic skin conditions, vitiligo, so pigmentation conditions, or melasma is another pigmentation condition we see commonly, acne, alopecia, hair loss, and obviously skin cancer. So dermatology has lots of different areas to it. So there's medical, there's surgical, procedural, and some cosmetic as well. And as you go along in dermatology, you can be a generalist who does most things. I do mainly medical, or you can do specific surgical training if you wish. Some people go on and be specific cosmetic dermatologists as well. Or you can just do most things broadly if you wish. So what a dermatologist is not, and I think this is important because there can be misconceptions about what a dermatologist is. It's not a beautician. So it's not just talking about creams. It's not face. You know, I do get some patients coming in saying, I just want to talk about my skincare routine. And that I find annoying because it's a very long study time to get there, and I'm not a beautician. It's not a skin cancer GP, or a skin cancer doctor, though we do so much skin cancer. GPs can go on and do you know, specific training in skin cancer if they wish, but it's not purely that. But there is so much more to dermatology than just skin cancer. It's not Dr. Pimple Popper, so it's not all social media. It's not you know, glitz and glamour like that at all. And it's not primarily a cosmetic doctor. So people can think dermatologists are purely people that do injectables and lasers, and you can certainly choose to do that if you wish, but that is not just what it is. So the talk is on your medical future, and so to give you an idea of where that may lie if it's with dermatology, I'll talk about my medical past. So it sounds involved, but all of it I didn't know at the time is extremely relevant to where I've ended up. So in my undergraduate, I did a bachelor's and a bachelor of laws, which ended up with honours for the law part of it. So that was 2 degrees that I did in my undergrad before going on to do medicine. And as Rochelle said, I did a lot of, still do a lot of music as well, which is my big hobby. And so then I was a solicitor when I applied to get into medicine, and passed through the interview process and got on there. Then in my final year of, I don't know if it's the same now for you in 4th year, but we got to do an elective in 4th year, and I wasn't really sure what to do. And my father, like Michelle, was a respiratory physician who's retired now, but he was at Green Slopes for over 40 years. And I said, oh, Dad, what should I do for my elective? There's nothing really that I have enjoyed. I ended up winning the psychiatry prize. All of this will be relevant shortly to why I'm telling you all these things. And I said, oh, should I do an elective in psychiatry? And Dad said, oh, why don't you just go, you know, go to Green Slopes, go with one of my friends, just go and do a month of dermatology. And I thought, okay, because I hadn't really had that much exposure at that stage. So went to Green Slopes, which at that stage did have dermatology training on site. Now that has moved to West End. But anyway, I was there for a month, did the training, thought that, okay, that was fun, moved on. So then graduated from medicine, did my internship and JHO year at Prince Charles, which is hard work, and you're the dog's body in the hospital. And I, at the end of that 2nd year, thought, oh my gosh, like there must be something better than this. And you know, I'd done the standard rotations you had to do. Prince Charles doesn't have dermatology, so, and I hadn't really even considered it at that stage. I wasn't sure what I wanted to do. And each year, the Australasian College of Dermatology has their annual scientific meeting that moves around to each of the big cities. And in my JHO year, that year it was at the Gold Coast. And they have their graduation ceremony for the successful dermatology registrars. They have their fellowship graduation during that conference. And so one of the dermatologists I'd worked with previously at Green Slopes, who knew I did music, said, oh, look, we'd really like a brass group to play at this, you know, to bring some kind of fanfare to the ceremony. Can you come? Put together a group. Sure, no worries. Went down, played at it, then was chatting with the dermatologist afterwards. They said, how's it going? I said, oh, look, I'm not really enjoying my JHO year. And they said, oh, well, next year, why don't you come and do a day for us in our clinic? Come and have some experience in dermatology, do it as a paid position, see if you like it. I thought, okay, how else am I going to sustain, you know, my family if I'm just working 1 day a week? And they said, oh, yeah, do it. Why don't you do some research at the PA, which was not all the fancy research buildings they have at the PA now. It was just very small. And I thought, okay. So I did research for a day a week. And then I got in touch with UQ and did some medical tutoring in PBLs, the clinical coaching and communication skills. Had a baby during that time. So I had my baby, one of my children before I started, and then thought, all right, well, let's apply and see. And fortunately, planets aligned and I got onto the program. So I see that you saw this slide before. And so dermatology was down here. But the process for the actual application is, so this is the college website. So dermatology is Australia-wide for the application process. So anyone who wants to get onto the program can apply through that website all around Australia, and you do put in preferences for where you would like to go. So even though you're from Brisbane, you may end up training in Perth or Tasmania, depending on where the positions come up. There's only something like 600 dermatologists in Australia, so there's not many. And in Brisbane, the fellowship exams were just a week ago and 5 new graduates came through. The year that I sat, there were only 19 new graduates for the whole of Australia. So there's really not that many. And the training positions, the number that there are each year depends on who passes the exam, how funding for positions. Sometimes there's more, sometimes there's less if people go on maternity leave, things like that. So it can vary between only, I think there was only 1 Queensland position last year to, up to 7 or something like that. It really varies from year to year. So the process is that you have to have graduated from medicine, obviously, and then it's a minimum of at least 2 years of work after that in usually the hospital. So you must do the general medicine, a general surgical rotation, and then it's encouraged to just do a broad range of things as well, just to sort of show you've got a good medical background before you apply. It would be fairly unusual to get on in your 3rd year out, so in your PGY3 year. Usually it's more around year 4 and 5. But then if you apply and you're successful, and I'll talk about that process shortly, then you're selected into the program, and then it's a 4-year training program from there. So the actual application itself, there's 5 main parts to it, and the first one being academic performance. So for me, having 2 other degrees, getting one of the prizes, having honours for law, all those things get a lot of points and counted towards it. Then your clinical experience, that can, so that for me was a couple of years working in the hospital system. But then sometimes there are people who go on and apply to dermatology or a physician training or things like that, that can be useful as far as showing that they've got clinical experience and a good medical basis as well. So this next part's important, the demonstrated interest in dermatology. So for me, again, that was me just having fate and meeting these people at this medical conference who said, come and work for me. But through that, I had done, working in clinic. I think I also went along to the PA, which has dermatology, and started just volunteering on a few days, helping out in clinic at that stage. That process has all changed now. But, I was showing that I was interested. I attended education sessions. The registrars in dermatology have Wednesday night education sessions. They're done on Zoom currently, but they used to be at the PA for years and years. They've had that, and anyone is welcome to go, from medical students to JHOs. You're very welcome to go along to those meetings, and then you keep a record of it, and then you can say that you've gone to those. The scientific meeting that I mentioned before, medical students can go to those, or junior doctors. So anything along those lines to show that you've had an interest. I was working towards some research, but certainly any publications that you have done or any research, and it doesn't even need to be in dermatology. So I was talking to one of the registrars recently who was working in ED, and she ended up doing a paper on migraine or something, presentations to emergencies, and that gives points in that area. So it doesn't have to just be dermatology based. It can be something on the ward through your rotations when you're there, or presenting on grand rounds or hospital meetings, things like that. Anything that shows that you have some experience and have stood up and had a go. So I'd recommend you to keep a record now, and so you have things that you can put in that section when it comes. And then the last thing on community and leadership. So my music was a huge thing there. So like starting this orchestra that I play in and that sort of stuff. All these things were just things I did in my life, but it all ended up being really vital to that application process and really helped me with that. So what I've got here, I just took as a snapshot from that the Dermcol website, but you see down the bottom there as well that there's a real need for rural dermatologists. So rural experience is important. There's training that's done at the Sunshine Coast Hospital and up in Townsville as well, and in Cairns actually. So there's lots of experience, and if you live in any of those places, or you're on holidays or want an elective to go and do that, by all means they would encourage it, and that would look really positive for you. So after the application process, if you pass that stage, then you're offered an interview. They've been on Zoom last year, and this year for me, I went down to Sydney, and all the applicants usually would go to Sydney to the College of Dermatologists to have it done there. It's changed a bit from when I did it, but now they separate it into two parts. There's one panel that's more behavioural questions. So what would you do in this situation, or tell us about a time when such and such happened to you. And then the other panel talks more about your actual CV and what you put on your application program there. So, tell us about your dermatology experience, or talk to us through your research project that you've done. And so you can see there, they've got the stats on the actual application. So, only about a quarter are successful on their first application. And you have to really consider that, because if you don't get through that interview process, then that's another 12 months before you can apply again. And of course, you can use that time to build up your CV and, go to meetings, go to courses if you want to. I went to some GP skin cancer courses that were run by GPs, but skin cancer courses for any doctors. So I attended those. Lots of different things that you can do, but, you have to decide for yourself, will that work for you? Will that work for your family? If you didn't get on, what you would do? Would you apply for a different training program in the meantime, so you can actually earn a living, get some experience, put that on your CV? But then does that, if you do maybe do that part-time, to then allow yourself time to also build up your dermatology experience? Things like that are definitely worth considering. But then if you pass your interview, then you're offered a training position. And as we said, they can be Australia-wide, depending on where you, perhaps where you rank in your interview process, and how many positions are available. So the training program in Queensland is 4 years. There are different hospitals that, there are only a few hospitals that have dermatology at it, being the PA, the Royal, the Mater. As I said, Greenslopes has inpatient rights, but the actual clinic that does the training for that's in West End now, which is called QI Derm. QCH at the Children's Hospital does it as well. The Sunshine Coast, Townsville and Cairns. There also used to be some overseas positions as well, but COVID has stopped that for the time being. I had my second child halfway through the training, so I did my first 2 years, took the third year off as maternity leave, and took my third year of training off, and started the third and fourth years of the training program after that. But there are also opportunities for part-time or shared work as well. But the other thing that's important is that training is hard. Again, I think there's a misconception. A lot of people think, oh, it's just, if it's wet, make it dry. If it's dry, make it wet, and that's dermatology. It's absolutely not true. It is, it is really, really hard to do it. I remember getting up at 5 o'clock, studying for 2 hours before work, going to work 7:30, coming home 7:30, saying hello to my kids, and studying again till 11 o'clock at night. And that was my third and fourth year. So you have to know everything, and there is so much. There's more than 3,000 dermatological conditions to be aware of. So it is really tough. So the training itself, there's on-call that you need to do, and that's also for peripheral hospitals. So if you're at the Royal, you could get calls from Hervey Bay or Maryborough. PA does formal telederm as well, so people will send you pictures, and if you're in a really busy clinic and you're trying to deal with that, it's prioritising and working out how you can. There's inpatient work as well, and these can be people who have severe eczema that need particular dressings, or they can be people whose skin is blistering off head to toe from a really bad drug rash. So they can be very interesting but challenging and sick patients as well. There's many the clinics are relentless. There are just so many patients to see always, but there's also lots of interesting clinics as well. There's transplant clinics that you can attend. attend for patients who are on immunosuppressants for their transplants, but as a consequence can get lots of skin cancers. The PA has a prison clinic, which was my favourite. That was absolutely fascinating to go into that building and see those patients, and rural opportunities as well. The teaching sessions, as I said, so the registrars have every Wednesday night that anyone's welcome to attend, and it's a really good place to start. There's also path teaching for the registrars, not for medical students or junior doctors, but there's pathology teaching, because as part of the exam process you have to be able to read histopathology slides and diagnose off that. There's meetings to attend, like grand rounds, as we said. There's clinical meetings from each hospital. There's the annual scientific meeting that anyone can join. There's the Australasian Dermatopathology Society there, that there's meetings to attend, and a lot of that's very easy now if it's all on Zoom. So you can, all of those things are really worthwhile going to. And then the examination requirements, it's intense. So in first and second year you have to do research. There's particular research requirements you need to do. Then there's modules that are done online. Third year it relaxes a little bit, but then in final year the fellowship exams, it's 12 hours of written essays and true false questions. Then there's a short case viva day, which is where you do the microscopy as well. And then there's long cases and procedural dermatology too. So it is tough. So if you want to do it, you really need to commit and know that it's going to be tough. So Michelle mentioned earlier about making sure that you have a balance in your life. So important because you really can just be sucked into the bubble, and the only people you talk to and see are your dermatology colleagues. Yes, but so it's worthwhile, but it's hard. But then it is a great place to be. So dermatology has public and private work. Similar to Michelle, there are not many public jobs available. Sometimes new positions come up. So the Sunshine Coast Hospital, it's only been new in the last few years to have dermatology. So as they expand, a few new job opportunities arise. There's lots of private work though, and that's primarily, well, that's where I work, but a lot of the public doctors also work in private practice too. So the things I really like about the job are the pace. I am not one of these people that gets an adrenaline rush from working, dealing with the car crash that comes into emergency. That is not me. I much rather sit, reflect, think about it, look things up if I need to. So that suits me much more. The hours are great. Now in private practice, there's no on-call. Patients can email after hours, or leave messages at work that you have to deal with if you're not necessarily at work, but it's certainly not the same as being on call. And I can pick and choose my hours. So I don't work full time. I work enough to have a balance with my young family, as well as working enough to keep me interested. The variety of what you can do is great. So, I can go from cutting out a skin cancer to looking at a rash on a baby to dealing with sun damage in an old person to acne in a teenager all in a morning. So that's really interesting, but also there's comfort in the common things. So skin checks, I do skin checks all day, every day. And that's also nice too, because I enjoy, I do the same system every time. And I enjoy doing that too. Sometimes when you just don't have to really think as hard. I really enjoy the difference that I make to my patients' lives. So whereas, Michelle, perhaps the difference she makes is someone can actually breathe properly now. The difference that we make as dermatologists is can be a lot more the visual. So acne is the classic example. The teenager who comes in, they've got acne on their face. Sure, they're not going to die from their acne, but that is psychologically scarring for them. The number of times I see just a withdrawn, not confident teenager come into the room, and then the difference when their acne is actually treated, and they smile and they're happy and they're wearing different clothes from what they wore before because they don't have acne all over their back. That is so rewarding, the difference that you can make in that person's life. And learning, it's always ongoing learning. I'm reading journals every day. I get so many different emails every day, and there's always new pearls and new tips and things that you can pick up. So I thought, so what I do is so visual. So I thought I would just show some pictures of, these are just things I took snaps of last week in clinic. So this is acne, as we said. So the number of patients who come in and they've had their face like this for years, and it's like, why didn't you come in sooner? They can, get scarring and things like that will last them a lifetime. So I really enjoy treating that. This is a patient with psoriasis. So we said it's hair, skin and nails. These are some of the nails and psoriasis on this patient patient's foot. Hair, so this one with the full head of hair and that bald patch in the middle, that's called alopecia areata. This old man's scalp here, you can see it's just, there's such photo damage on that scalp. And then he's got an inflammatory condition that's like a reaction to the sun damage called erosive pustular dermatosis, which is that crusty part in the middle. So skin checks on the calf here, that was a melanoma on this man, first skin cancer he'd ever had. This is a little boy, he's got periorificial dermatitis, which is like a skin condition that, a barrier dysfunction sort of condition you get on your face, it's super common. This one here on the trunk, that's pityriasis rosea. So this is something that's commonly seen in GP, but sometimes GPs aren't comfortable with seeing children or seeing rashes or seeing anything dermatological. They send a lot of that on as well, which is fine. Oh, I put this in to remind me. The next slide is some genital slides. So if avert eyes, if not happy. But genitals are a big thing too. And, you know, gynecologists don't get, you know, they're great if it's actually vaginal and inside. That's not what I do. Mine is vulval and exterior. And so gynecologists, that's skin. That's not what they do. But these are a couple of vulval things. So the one on the left of the screen is called lichen planus. So you can see that it's oh yes, my arrow works here. So this is all completely scarred up around here. This is itchy and sore in this patient. This is another really interesting thing. So this is a skin cancer in this lady's mons pubis here that's called extramammary Paget's disease. So you may know Paget's disease, which is commonly presents unilaterally on the nipple as an extension of underlying breast cancer. This is extramammary. So sometimes patients can get this as a skin cancer in that area that can be a representation of underlying malignancy in the genitourinary or colorectal tracts. So those all need to be examined in this patient who came in just with this itchy rash. So sometimes, you know, again, that's about making the difference. Like that was really important with this lady just last week, that she goes on and then has screening for underlying malignancy. So the final thoughts that I had about dermatology for you to consider when you're a medical student is that it's not impossible to get onto the program. You will have people tell you that it's extremely competitive, which it is, but it's not impossible. But if it is what you want to do, then you need to commit to it. You need to commit to what you need to do for the application process. And most applicants are around PGY 4 or 5 before they actually get on. You need to also make your own opportunities. So as Michelle said, go along, introduce yourself, start with the registrars. If you're, you know, a medical student and you think it's for you, maybe in the holidays, go along to some clinics if you can, go along to the meetings, talk to the right people, and put yourself out there. So you can see if it is for you, but also then that, you know, that will add up for you on your CV. There are some formal junior rotations in some of the hospitals, not many, but the PA, the Royal, Sunshine Coast and Townsville, they all have junior doctor rotations. Again, competitive, but one of those might be right for you. Any courses that you want to attend, you've got to seek your own opportunities there, but that is good. Meetings you can go to, research again can be in anything, but that's looked on very favorably, and write down everything that you do. Again, training is hard. So the exam is hard, the training is hard, the expectations are high. So it's not all glitz and glamour. And finally, make sure it is what you want. If this is something that you are going to commit to, then you might end up being PGY 10 by the time that you finish. And so are you the breadwinner in your family? Are you going to have children? How is that going to work for you? What if you don't get on and you've got an extra year? What if you fail the final exam and you have to put in another year? It can be expensive going to conferences. It can be expensive going to courses. So to gain the dermatology experience, how are you going to make that work for you? So it's definitely worth considering. If it is what you want, make sure it's what you want. And good luck. So this was a picture of me at my fellowship graduation when I was pregnant with baby number 3. So that's it. Any questions?
Thank you so much for that, Melissa. I've actually got a new appreciation of dermatology, definitely. That was amazing. You mentioned, again, similar to Michelle, that there was some networks that potentially the students could get involved with. Is that something they need to sort of actively seek from the wards and things themselves, or are there some links that you can send me that I can put on our
No, they're sort of,
program?
networking part of it is really sort of up to the individual to seek out. I would say, again, the first place would be try and get in touch with any of the registrars or in the hospital, or if it is one of the ones that has an intern, talk to them if you want to, they'll be able to help you. But the registrars would probably be the best place. I would say the Wednesday night meetings are really a good thing to be involved with, and the registrars can help you get involved with that. But then also things like the meetings, like the annual scientific meeting or the DermPath meeting, it's a bit harder now if it's done on Zoom, but hopefully if it's face-to-face, you go to those, and they do have reduced rates for students or junior doctors, and you have to put yourself out there. And, you know, you can meet people who, like, meet dermatologists who are perhaps in the public system who have, oh yeah, there's a really interesting case report I was thinking of writing. Great, there you go. And you can get started that way.
And in terms of the research for application for the program, do you know if there's a recency clause, so that it has to be done within the last 5 years, or is it just your general history they look at?
Don't know about that. I would say
Check the website.
Probably more recent. I mean, great if you've got something older, great, but also to show that you're still actively seeking out that sort of thing as well would probably be looked on better than just relying on something that's a bit older.
Excellent. And I think you answered the other questions about things like consultant positions and training applications. Just one more. So one particular person, how important do you think is it to get formal dermatology experience before you apply? So you mentioned there's lots of ways, things like meetings and things, but actual, like, if, for example, getting rotation or working in a clinic.
So I think the college website, and my understanding is just, it says dermatology experience. So, you know, even if you're a medical student and you go along in your holidays and just do a couple of weeks in the clinic, great, you've got something you can put in that box rather than showing nothing. So it's maybe not just experience, but also interest. So, you know, things like going along to external courses to show that you're interested in it, those kinds of things. I don't think it necessarily, of course, it would look better if you have been working in a clinic than if you hadn't, but even if you don't have that opportunity, again, creating your own opportunity so you can put something on there, even if it's just like going to one of the hospital meetings, you know, that's just on a morning, great, you can write that on saying I went to the clinical meeting at the Mater, you know, something like
Excellent. And from my understanding, the Dermatology College takes that application process very seriously. They really do look through your CVs and
they do. Yeah. They really do. Yeah. And so get on, if you want to see further about it, get onto that website before, or just Google, you know, DermColl, which is, you know, Dermatology College, and it's got everything on there you need to know for the application process. I think it opens in January, February each year and closes around April.
Excellent.
Yeah.
I think that covers all the questions that I can see, and that brings it, it's just after 1 o'clock too. So thank you so much for your time, both Melissa and Michelle. That was amazing. This will be recorded. Hopefully you'll be all right with that, and available for future students to view as well. So thank you so much.
Great. Thanks, Rochelle.
Take care.
Bye.